Hi, this is Michael Kober. I'm taking a look at an ultrasound done by Bo, Marissa, Joe, and Nick in July. This is a parasternal long axis. This is a very sad cardiovascular system patient, I'm sure, with short of breath. What we're looking at here is, very briefly, we'll talk about the heart and then we'll talk about the more interesting finding. So this is a parasternal long axis, so we see a left atria, left ventricle, aortic valve, and outflow tract, right ventricle. This particular heart looks sad because you don't see, what you do see is a very poor systolic ejection fraction, very poor left ventricular squeeze. Left atria is dilated as well as the left ventricle. The mitral valve leaflets you can see here are opening only just a bit. The anterior leaflet of the mitral valve is nowhere close to the interventricular septum, which is consistent with a low EF. The more interesting finding here is that we see a large anechoic area posterior to the heart here, which is concerning for fluid. The question that then comes up is, does this represent a pericardial effusion? Do you need to worry about tamponade? The answer in this case is no, because this is a pleural effusion and not a pericardial effusion. The reason you can say that is because you take a look at the descending aorta, which is here. And to do that, you need to be looking deep enough. So if you had your depth at, let's say 15 centimeters, you would miss all of that down here. So if the fluid collection is entirely between the posterior of the heart and the descending aorta, that's concerning for a pericardial effusion. If a portion of the fluid collection is also posterior to the descending aorta, like we see in this case here, then that is consistent with a pleural effusion, not a pericardial effusion. This is obviously difficult or important to figure out because these two effusions are treated very differently. Things to take away from this video would be looking at the heart and the parasternal long axis with adequate depth. If you do not see the descending aorta, then you are not looking deep enough. Thanks.